Good evening, ladies and gentlemen. My name is Abdul Kishore. I'm the Chief Revenue Officer for Seva at Home. This webinar today comes to you from Seva at Home in collaboration with ACE Insurance Brokers. We are very happy to have you with us this afternoon, and we are going to talk on heart matters. With me on the screen, as you can see, is the eminent Dr. Vinayak Agrawal. Dr. Vinayak Agrawal is the Director and Head of the Department of Clinical Cardiology and Cardiac Imaging in Fortis Memorial Research Institute. With 25 years of rich experience, Dr. has experience in interventional cardiology as well. As a great orator, and a lot of questions that you would want to address to him to this afternoon will get answered on the matters of the heart. Seva at Home is a health and wellness concierge. We, besides doing Seva at Home, which means healthcare at home, in sending out doctors and nurses, care attendants, physiotherapists, nutritionists to patient home, we also manage medical rooms, run health checkups, and now we've launched a series of clinical programs, one of which is the cardiac preventive care program. And with a lot of young deaths taking place these days, it is only prudent to talk about this topic as much as we can. Over to you, Dr. Vinayak. Dr. Vinayak will make this presentation for about 20-25 minutes, and then we will take questions from you, which you may put in the Q&A box. So thank you once again for being with us this afternoon. Over to you, Dr. Vinayak.
Thank you, Atulji, and I'm happy to be here trying to put forward the right perspective about cardiac health. I'll show you a few slides as we go along. Are my slides visible, Atulji?
Yes.
All right. So the way I approach this topic of matters of the heart is to touch upon the basics of heart health and health in general. And there are a lot of myths which you are riddled with in your day-to-day life about, why so many of the young people are dying because of heart issues, sudden heart attacks, sudden arrhythmias. A lot of questions related to COVID, whether the vaccines cause heart attacks or not, whether these sudden cardiac deaths are related to the vaccine or COVID. The fact that are we seeing a lot of these young deaths after COVID, or is it something which we have been seeing for a long time? I'm going to discuss a lot of these things as we go along. The idea is also to tell you the right perspective about what causes the heart attack and what are the risk factors. So if you look at India, and some of this data is very, very important. So I want you to actually listen to that carefully. We are about 1.4 billion people. And if you look at the demographics of India, we are a young nation. About 60% of our population is less than 60 years of age. So we are a young nation, which is actually an excellent, I would say, workforce dividend that we have over the next 10 years. And if you look at the worker class, 40% of India's population, which is nearly 537 million workers, is actually working class or actively working people, out of which 65% of the people are between 15 to 60 years of age. So a lot of young people are there in our country. US population is around 350 million. So remember that we are almost twice of that is the younger population of India. And we are a huge nation, and you must remember this when we discuss further things. Now, this so-called young population of about 15 to 60 years of age, it is too huge an elephant to be ignored in the room. And we have to look at what are the non-communicable diseases or risk factors which lead to the health issues in this workplace or workers of India. We all come into that same domain of the working class, which can be affected by various risk factors. Now, this is a very old slide of 2007, but even 15 years back, you can see that the cardiovascular diseases. So cardiovascular diseases involves heart attacks and strokes. Strokes is for, when the clot goes to the brain and it causes paralysis, etc. That's called a stroke. And heart attacks or myocardial infarction is when your arteries get blocked and you get a heart attack. So cancer had about 20%, COPD or smoking, etc. related was 10%, HIV 8%, tuberculosis, etc. about 5%. But the major chunk of worldwide causes of death was still cardiovascular disease in 2007. This is an equally old study, a landmark study, which was done in 52 countries called the InterHeart study, which for the first time brought out the so-called risk factors which lead to the cardiovascular diseases. So diabetes, hypertension, smoking, high cholesterol, abdominal obesity, psychological risk factors, lack of regular physical activity, and inadequate consumption of fruits and vegetables. So this was, for the first time, the last three, the psychological factors, physical activity, and inadequate consumption of fruits and vegetables were brought in as risk factors, which are relatively subjective. My psychological stress may be different from yours, but then we know that stress plays a role in development of cardiovascular disease. In a nutshell, these are some of the modifiable and non-modifiable risk factors, like you can't change your family history, or the fact that males less than 50, in India, we should take it as 40 years of age. Family history where the mother, father, brother, sister, so the males of the below 55 years of age, and the females of the family, the mother or the sister gets heart attack or stroke, etc., below 65 years of age are called family history of heart disease. Somebody getting it at 80 is not part of the family history as such. Some of the modifiable risk factors like smoking, obesity, stress, diabetes, hypertension, high cholesterol, these are modifiable risk factors. The most important thing to remember is the multiplier effect. So if you have hypertension with diabetes, you are at almost 8 times higher risk as compared to just having diabetes and hypertension, which will attribute about 2 to 4 times higher risk of heart disease in these cases. So there is a multiplier effect. The more risk factors you accumulate, the higher is the risk, exponentially higher risk of developing heart disease and stroke. And this is a very latest data published in Global Heart in 2021, that the major reasons for heart attacks is high blood pressure, tobacco consumption, which is smoking or you're chewing tobacco, and high carb diet. Air pollution is coming up in a big way. High sugar, being fat with high body mass index, high LDL cholesterol, CKD, chronic kidney disease, which is again becoming a big issue in the last few years, malnutrition, alcohol use, and then unsafe sanitation, water, etc. If you look at the hypertension, it is one of the biggest killers, especially in the Indian subcontinent. So is diabetes. We are actually #1 nation, or projected to be #1 nation in the next few years for diabetes. There is also very high incidence of mental disorders in the young. So a working class has a lot of psychological issues. This is a very important slide, which was published in the Lancet. So this is something which we ignore a lot. And here, the role of clinical psychologist is very important in a working class atmosphere. Women are a special subset. They have their own separate risk factors like, menopause, central obesity. There are pregnancy-related hypertension or diabetes, which occur in some of the individuals. There is also the risk of social isolation as they grow older. So there are many, many risk factors which are available, which are attributable to the cardiovascular diseases. Air pollution and pollution of various forms is also coming up in a big way and is attributable to even coronary artery disease and higher risk of CVD. As you can see in this, the exposure response relationship between pollution, PM 2.5 and CVD. There is a direct increase in stroke and ischemic heart disease in the patients who are exposed to the pollution. So there is an epidemic of CAD, or coronary artery disease, or CVD. And if you look at the Indian youth, 25% of patients get heart disease at less than 40 years of age. And 50% of heart attacks occur before 55 years of age. So these are very, very alarming data. I get so many patients who are less than 40 years of age coming with heart attacks in my emergency. And this is not something which is just a statistics. We see it every day, where you're getting sudden deaths in young, sudden heart attacks, strokes, etc., which have become much more prevalent than what they were about 10 years back. Most of the people in this bracket are males. 60% of them are smokers. 15% have hypertension. 8% have diabetes. About 65% have abdominal obesity and high triglyceride and low HDL levels. So Indians tend to have this typical, dyslipidemia, where their good cholesterol, which is the HDL, is low, and the bad cholesterol, like the triglyceride and the LDLs, are high. So we have a conglomeration of risk factors in India, which is leading to higher and higher risk of CAD, or the CVD, cardiovascular diseases. So how do you achieve a healthy heart, or for that matter, health? So we need to have awareness, which is exactly what we're doing right now. The second step is to screen. So we take a cohort of people, like, for example, 100 people in an organization, we screen them with basic tools, and then we pick up the people who are at higher risk and we intervene in them, leading to prevention of future CAD. Now, a simple things which we must also discuss is, when do you suspect a heart attack? Now, please remember that a typical heart attack, the pain which occurs is usually diffuse. It is right in the center of the chest, as if it's squeezing very, very sharp and very, it's a diffuse. You cannot pinpoint it with a finger or with, localize it to one region like this. It is usually diffuse in the center of the chest, may radiate to the neck, jaw, both arms, the epigastrium, and the arms. So this is a typical distribution of angina, which is occurring during heart attacks. This is an acute heart attack, but sometimes patients have chronic heart disease, where when they walk a certain distance or at a certain speed, they get similar distribution of chest pain. And when they stop, it goes away in a few minutes. Any localized pinprick, tingling sensation, or localized pain is never heart. Anything which is brought on by exertion, which increases on exertion or any activity, is likely to be angina, or what is known as a heart pain. Now, there are 3 coronary arteries. If they develop plaques like these, it may lead to heart attacks. So this is an animation to show you what a heart attack is. So you can see that these coronary arteries flow on the surface of the heart. And this is a zoomed view of one of the arteries. You can see that there is this yellow plaque which is deposited in the coronary arteries. And if there is a plaque rupture, a clot forms at this point, which leads to the blockage of the artery suddenly without any warning signs, and leads to a damage to the heart muscle, which is known as myocardial infarction or heart attack. This is an important slide to understand that on the left, this is a normal coronary artery with no plaque. These 2 arteries have 50 to 70% block, and this artery has 90% block. So we would assume that the 90% artery will get the heart attack first, but actually it is these 50 to 70% arteries which are blocked because of a high lipid content in the plaque. You can see this yellow plaque here has a very high lipid content. It's a soft plaque. It can rupture easily. It is these 2 types of blockages which are at much higher risk of heart attacks. This 90% blockage is a slow accruing blockage. The lipid core is small. It is a very hard stony plaque. It doesn't burst. It will give you angina or symptoms, but it will not cause heart attack, because the plaque rupture is important to cause accumulation of a clot or formation of a clot at the point of rupture. We can pick up patients who are at risk by doing simple ultrasound of the neck, called the carotid intima medial thickness. Here you can see this thickness of this intima is normal. Here the intima is much thicker. This is a simple ultrasound. We can do a computed coronary CT. So we can look at the coronary CT angiograms. You can see these angiographic films, but these should be done judiciously. This is not a screening test. it should be ordered only by your cardiologist if they think it is needed. More easily to do is coronary CT calcium score, which is a simple scan like an X-ray, no dye, no needles. And this is a normal, zero calcium score, and this is a high calcium score patient with a lot of calcium or white deposits in the coronary arteries. These patients are at higher risk of developing heart attacks. Lifestyle modification is very important. So weight reduction, dietary prudence, exercise, cessation of smoking, and then relaxation and meditation, etc. important. The food pyramid also emphasizes the same thing, that you must have more greens and vegetables and fruits in your diet, less of carbs, less of fats. Low fat dairy products are good. Less of red meat, and meat in general is avoidable, and definitely oil should also be less. But food prudence or dietary prudence without exercise is of no use. So you must incorporate some form of a regular physical exercise, which is a must. So these are some of the untouchables, which you should be avoiding: the saturated fat with very high trans fats content in them, which produces very high inflammatory dietary inflammatory index is high. So these foods lead to much higher risk of heart attacks and strokes. The eatables are your greens and the fruits and vegetables. Low fat dairy we've talked about. Most of the fats are all right, but for example, your kachi khani sarson ka tel or the mustard oil is excellent. You also have canola oil or say olive oil, etc. are quite okay. Desi ghee is also not bad because it has a good mix of mufa and pufa. So best is to rotate your oil, and overall quantity of the oil should be not more than 15 to 20 grams a day. The alcohol should be minimized because it does increase the risk of cancer by 3 times, though not directly linked with heart attacks. But we know that alcohol is injurious to your health, and the amount of alcohol which you should take should be less. Then fish is good. So the freshwater fish is a good source of, say, omega-3 fatty acids and PUFA. So they can be consumed at least 2 servings in a week. The nuts like your, say, almonds, etc. are also good for your health, should be part of your regular consumption. And physical activity of about 30 minutes of moderate to intense exercise 5 days a week is recommended. So meditation and recreation are, of course, very, very important. Now, as I was saying, that the risk scores, there are certain risk scores like the Q-risk score, Q-risk 3 score is what we use in our part of the world, which can actually look at whether you or any individual that we give a questionnaire to can pick up, we can pick up who is at high risk using these questionnaires. This takes not more than 5-7 minutes to fill up, and it can tell us whether you are at high risk of developing heart attacks or strokes over the next 10 years. And then we intervene in terms of using, dietary prudence. We have people who have actually a lot of psychological stress. So a psychologist comes in, you have treadmill tests, stress echoes, calcium scoring, etc., which can be done with the help of a physician cardiologist. You have a dietitian who's on board. So these interventions can really help you to take care of your health and prevent future heart attacks and strokes. So one of the other things which is recommended in the workforce, especially in the elderly age group, is the influenza vaccine. And one of the things which is coming up in a big way is that, if you at your workplace, if we intervene with these small little interventions, like picking up people who are at high risk, looking at their blood pressure, looking at their lipid, keeping a close eye on their, targets that we encourage them to meet. So like every 3 months, we look at their progress. We have a psychologist, a dietitian on board who's holding their hand, taking them through weight loss program, etc. So these workflow interventions or workplace interventions have a definite positive return on investment or ROI. And in fact, every dollar spent on the work site health promotion programs leads to a saving of about $2 to $6. So even in monetary terms, by intervening at these levels, you actually are not only promoting health, but there is a definite ROI, positive ROI. The future is mobile health. So you have a lot of gadgets like the Apple Watches, etc. But there's many more which have come in, which can be introduced in detection and, taking care of your health. This is something which Seva at Home does. We actually look at your risk factors. We had, for example, 243 patients were screened, out of which we found moderate to high risk in 28 patients, and then they were taken for further interventions. So this is something which Seva at Home does, and the concept is what I've just discussed with you. Thank you.
Thank you, Doctor. Ladies and gentlemen, put your questions in the chat box and for the Q&A box, and we will take it up from there. In the meanwhile, let me just talk to you about what we are doing at Seva at Home in terms of what we call as the cardiac preventive care program. This cardiac preventive care program is designed by Dr. Vinayak and his team, and actually begins with an assessment which is an online tool, and one has to answer a set of questions to determine what is his risk, whether the person is at high risk or low risk or moderate risk of a cardiac event in the future. And this is a very simple set of questions that one answers online, and I'll give you that link in the chat box. It will also be there on the ACE Insurance Brokers platform where you can see it. But let me just begin by taking you through this set of slides. Just a second, they're not moving. So doctor was mentioning to you about how there's been a recent spate of cardiac arrests, especially in the young. And they've been all across the world. We've seen baffled and shocked family friends. In India, we've seen a lot of these young celebrities who have died of cardiac arrest in recent times. We need to take care of ourselves. And so once again, the slide is not moving. There is a problem, I think, with the slides. %86 of cardiovascular deaths, it is said, could be avoided through prevention and treatment. This is as per WHO guidelines. What we've seen in this study by Dr. Milani and Dr. Carl Lavi is that over a period of 6 months, when they've taken a cardiac preventive care program, such as the one that this team at Seva at Home has designed, and I will take you through that, 57% high-risk participants were converted into low-risk status by the end of the 6-month cardiac program. There was a saving of $1,421 per participant in medical claim costs year on year. So what is the implication for corporates? When you extend this to your employees in the corporate world, worksite health interventions lead to significant improvements in health and cardiac risk. A high-risk health status can be converted to low risk in a relatively short period of time. And there are benefits for the employers as well as for the employees. Reduced absenteeism, higher productivity, a stronger image, and for the employee, an improved cardiac health, a sense of security, and unnecessary trips to the hospital are avoided. The whole program consists of interventions by nutritionists, psychologists, physiotherapists, a cardiologic consultants by a cardiologist, cardiac nurse. This is pre and post assessment. And this screening of employees using the cardiac risk assessment tool is at no cost. And this is a highly subsidized price of 5,000 rupees per month for 6 months for at-risk employees. For corporate employees, we've discounted it to 25,000 rupees For ACE insurance brokers, it is even brought down further to 22,500 for a period of 6 months. What does it entail? It entails visits by the physiotherapist at home, 6 visits in 6 months. By the psychologist, online consultations, 6 consultations in 6 months, one every month. 6 consultations by a nutritionist in the 6-month period. And a senior nursing visit by a senior nurse 6 times in 6 months, once a month. And physician in-person consultations as well as cardiologist consultations once a month. This is for high risk. And the same thing is once in 2 months for a person at moderate risk. Then you, of course, get to attend webinars and attend special sessions. So contact us on this, and I will leave this slide behind later for you to see. But meanwhile, let's take up questions from the chat box. So, Dr. Kiran Teja wants to know, want to see the slide of best eats, please. I guess it was shown, but I think you could still talk about it.
What about what? Sorry?
Best eats. What are the best foods to eat? Yeah.
See, I think I see a lot of people going literally maniacal about the kind of diet which should be had. We don't need that. Just remember some of the basic pointers, which is your diet should be rich in fruits, greens, vegetables, salads. Now, how do you do that? So you must have at least 2 portions of some fruit, whether it is, apple or banana, or whatever you want to have. You can have at least 2 portions. 1 portion is about 1 whole fruit, right? So at least 2 portions of fruit every day. You can carry it with you at work. Have more of vegetables. So the best is to cut down on your chapatis and rice. Have more of your sabji, dal. If you're a non-vegetarian, then maybe eggs, some meat. Try and have more of less of fried meat, more of, say, roasted or boiled meat, preferably chicken, fish. Fish is very good. Freshwater fish is excellent. And oil quantity. So oil is not your enemy, actually. If you remember, if I can be very, very honest, it is the carbs. It is the higher carbs in your diet which actually are much more detrimental. So if you're taking about 20 grams of oil, which is about 4 tablespoons, which is pretty good quantity of oil, or even desi ghee, idea is to rotate your oils. Use, say, some desi ghee in some sabji, some oil in some other. Like that, you can rotate the different oils in different curries. And definitely minimize on your off the shelf, like biscuits, breads, bhujia, all these bakery products, pastries, pizzas, French fries. All these things should be minimized. I'm not asking you to stop them, but they are definitely the ones which lead to a higher risk of CVD. One thing which I've noticed with the present young generation is that there is a lot of eating out. You're ordering a lot of food from outside. There are much less food being cooked at home, and that is something which I can straight away pinpoint as one of the risk factors for early heart disease occurring, because the kind of oil or food, that the quality of food that you're having is something which is highly suspect, and I think it is.
The screen is frozen. I was just wondering whether it's the problem at my end.
It would.
Yeah, you're back.
Any other question? Yeah.
All right. So there's a question which says that it's related to exercise. If any exercise, if there's pain that gets initiated, then should we avoid it, or can we continue to do it and increase the intensity instead?
So as a rule, any pain which is, or if you're talking about heart pain, which is angina, so if you're walking fast, suppose you decide to join the gym today, and you go, and when you start walking on the treadmill, or you start doing your cross trainer or something, and you start feeling you start going spreading to your jaw, shoulders, arms, and you start feeling breathless along with that, just stop then and there. Because it could be heart related, it may or may not be heart related, but if it is eliciting these symptoms, I think it is better to get yourself checked out by a doctor before you reinitiate your exercise. Now, if you're getting pain, which is, say, not during the exercise, once you come home and you feel pain in your legs, thighs, arms, because you've just started exercising, that's a different musculoskeletal pain. Give yourself a break, stretch very well, stretch the group of muscles that you have exercised with, and most of that pain will settle down within a day or two. Then we re-exercise, or just exercise, probably very gradually upscale your exercise and not just rush into the gymming. One of the things which I've noticed with the gymming is, sometimes what happens is that you've been gymming for 6 months. Then for some work you went out, and then you've not been exercising for about a month. And then you come back and you start straight away to the level that you were at a month back, which is wrong. So do not ever start in an abrupt fashion any level of exercise. I have seen people starting the gymming, and within a week or two, they escalated to deadlifts of 60 to 100 kgs. They're running about 10 miles. They are pushing themselves. They're taking hot and cold baths. They're pushing body to the limits as if that is healthy. It is not. It is not healthy to push your body beyond, unless you have been trained gradually. A lot of people have been running half marathons or marathons without proper training, and we see a lot of damage done to the heart and to the muscles and joints in people who are inadequately trained. I've seen people come up with heart attacks. They have right heart failures. They tear their tendons, and the knee joints get hurt very badly. So please don't do all that. We are not here to prove a point. And it is not that somebody who runs a marathon is more fit than somebody who's running a 10-kilometer race. It doesn't work like that. So,
right. Yeah, thank you for that answer. That should settle a lot of people's question on how much to exercise and how frequently and with what intensity.
or anabolic steroids or injections, which enhance your performances, because they definitely damage your heart, increase the risk of heart attacks and strokes. So please be wary of the rampant use of these supplements, which are proposed sometimes by your trainer.
What are the tests, doctor, to check, and what should be the interval to check one's heart health, especially in the elderly?
So one thing we have to understand is one is to have a risk stratification or risk questionnaire. It's a simple questionnaire. It will give you what is the percentage of risk that you have over 10 years to developing a heart attack or a stroke. The second is to do simple things like lipid profile, sugar, your blood pressure check. You can do, if you are somebody who already has hypertension, diabetes, etc., you should do some sort of a stress test like stress echo or treadmill or test, etc. If you have a family history, then you should probably do a CT coronary angiogram. If it is very, very, early heart disease in your family, like in 30s or 40s. Otherwise, a simple coronary CT calcium score is good enough. So these sort of interventions, or some of these tests can be done, say, starting from age 20. You can start doing your lipid profile every 5 years, checking your sugar, fasting sugar, say, every 3 to 4 years. That way, you will not miss out on your risk factors early on. Check your blood pressure, say, once in a month, or if you're really young, maybe once in 6 months or 1 year. At least you know that over the last 10 years, this is what your profile of the common risk factors has been. Do improve your exercises, be consistent with your exercise, eat well, eat healthy, try and minimize alcohol, complete no to any form of tobacco or smoking. So some of these interventions, if you start very early on in your life, will pay dividends as you grow older.
Thank you. Participants, raising your hand, just put your question in the Q&A box. This is a webinar mode. We will not be able to unmute you. So, doctor, does heart medicine, do they cause side effects or on any other organ?
So, one of the myths which I keep hearing about is the use of statins. I think most of us don't prescribe medications very early on in the scheme of things. Some of the people who have very high cholesterols, especially the LDL being high, patients who have risk factors like diabetes, hypertension, family history of heart disease, we may start them on statins. Now, you see a lot of bullshit which is written on WhatsApp or in some of the other media platforms. Now, statins save lives. There is overwhelming data about statins use. If used judiciously, they actually save lives to a very large extent, preventing heart attacks and strokes. The side effects are 1 in a million. Most of them are benign, like some pain in the muscle groups, like your calves muscles, back of the thighs, your lower back or upper back muscles, etc. You may have these aches and pains once you start statins in some individuals, very small number of individuals. And we can always modulate the dose or change the group of the medication which we are giving you. But the whole concept that decreasing the LDL or the cholesterol overall helps is of absolutely irrefutable claim. The other thing is giving antihypertensives or anti-diabetes. Again, they are very, very safe medications. There are hardly any side effects of these medications which can be which can cause any damage or any lasting side effects. And most of them are benign. So overall, I would say use judiciously. These medications are very, very safe.
Doctor, does this chest pain, how does one identify whether it is a normal chest pain or heart attack? Sometimes it could also be reflux esophagitis, leading to some sort of a.
Yeah, so I did show a slide where I said that so imagine a 20-year-old coming with a pain who says that I started exercising and I'm getting this pain at this local spot here. And, it doesn't increase on walking. It increases on movement. When I move left or right, this area pains a lot. Now, this is a typical musculoskeletal pain. It can never be heart. So any localized pain which increases on breathing or movement, etc., is never heart. It is usually musculoskeletal. Heart pain usually starts in the center of the chest when you walk fast or you're doing any activity which is of significant exertion, like going up the stairs, lifting heavy weight. You start feeling this dull ache in the center, which rapidly spreads to arms, jaw, back. And that that comes over a period of time. It escalates as your exercise goes up. When you stop, it will come down slowly over a few minutes. That's a classical angina. Usually it will be seen in people who are smokers, high cholesterol, family history of heart disease, with plus minus history of blood pressure, sugar, etc. So in the young age group, you have to look at the risk factor profile, the character of the pain, to determine whether this is likely to be heart or not. Having said that, sometimes there are the atypical symptoms which may be related to heart. For example, in the elderly, they may present with 1 or 2 episodes of diarrhea, some epigastric or lower chest discomfort, and they may turn out to be heart attacks in some of these individuals. So in an elderly, diabetic, women of advanced age, you should keep a higher suspicion of heart attacks if they get atypical chest pain, nausea, vomiting, diarrhea, etc. Please get an ECG done, especially in diabetics and elderly individuals.
What should be the ideal breakfast for a 9-year official job?
Ideal breakfast for somebody what?
For a 9-hour official
9-hour
job.
official job. Well, see, it's a complex question to answer, and I'll tell you why. There are a lot of studies which have been done with intermittent fasting, where you eat a good breakfast, a lunch, and your last meal is at, say, 7 p.m., your dinner. And after that, you don't take anything for the next 14 to 16 hours. Now, that's called the intermittent fasting, which has been shown to be pretty good in terms of your heart health as well as weight loss, etc. Having said that, there is also a good bit of data that having that classical teaching that you should have a good breakfast and then lighter lunch and very light dinner, all this is something which is not really scientifically proven. I think it's more of a common sense thing that if your day is going to be like, if I'm a surgeon, my surgery start at 8 a.m. in the morning, I should have a heavy breakfast in the morning at 7 a.m. because I know I'll be working for the next 5 hours non-stop. So if I'm fasting or if I'm not having anything, then likely is that I'll go into hypoglycemia or I'll start feeling very, very hungry 2, 3 hours down the line. So it depends on your work profile. I think having a decent breakfast is not a bad idea. Then a lighter dinner for sure, because your level of activity after the dinner is going to be the least. And either way, I think intermittent fasting is a good concept. Otherwise, fasting at least once a week is a very good idea. You don't have to fast completely. You can, probably just cut down on your regular meal. Just take a, bowl of fruits or something, and give yourself, your body, some sort of a hiatus from rich carbohydrate or fat diet. So I think there is no ideal diet. We do follow the DASH diet or the Mediterranean diet, which are both rich in fruits and vegetables, low in carbs and fats. So that's the basic, tenet of a prudent diet or a balanced diet.
What activities can I do and what do I need to avoid? I think this question was answered. But would you like to say something? What activities can I do? I know you mentioned that you should, whatever you do, you should do it gradually and increase it.
So one of the concepts is of cumulative exercise, which is that suppose you leave your home at 7 a.m. You have to travel for the next 1.5, 2 hours to your workplace. You don't have time to do exercise in the morning. You've been sitting at your desk for a long time. Then you will have to devise ways to be active. For example, take a break every half an hour, 1 hour, just walk around. If you have to give a file to somebody, just walk across and give it. Go down and come up the stairs rather than take a lift. If you get a lunch break, then after your lunch, just take a gentle stroll all around the complex. When you go home, try and travel or walk as much as you can to the metro station or to your, wherever. Go for a stroll in the night if you can't go in the morning. Ideal is, of course, in the morning because you're empty stomach, you're light on your tummy, you can walk or run much better in the morning. But please remember that the people who do not run or exercise are at much higher risk of future heart attacks and strokes. There's no doubt about that. But an extreme of exercise is also bad. So I've seen that people who just keep pushing themselves with vigorous exercises, sometimes abrupt increase in exercises, pushing themselves, may actually end up with much more risk of arrhythmias as well as plaque ruptures. And there is some evidence which says that extreme levels of exercise can actually expose you to sudden cardiac death.
You mentioned arrhythmias. Some of these terms that are used by cardiologists and doctors. The layman doesn't really understand. What's the difference between heart attack and cardiac arrest, and what is myocardial infarction? What is CABG? What is arrhythmia? Just briefly, if you could, for the
yeah. So myocardial infarction or heart attack is when your coronary artery. So this is the heart. It has these 3 coronary arteries. If one of these gets blocked, suddenly it leads to a damage of a cardiac muscle and causes heart attack. And the heart actually inside has 4 chambers. So it is this muscle of the heart here which gets damaged and can cause, which is known as myocardial infarction or heart attack. If we do a bypass surgery due to blockages, we put grafts, we sew one graft here and the other end of the graft to the coronary artery like this, like a conduit. That's called a bypass surgery, which is an open heart surgery. We can put stents, which are basically medicated metal scaffoldings in the coronary arteries to open these after ballooning them open. That is called balloon angioplasty or PCI or PTCA with stenting. And arrhythmias basically mean rhythm disorders. So some of the times you would have read that there is a footballer or somebody basketball player suddenly drops dead on the court. Now most of these people may have what we call as a thickening of the heart muscle called hypertrophic cardiomyopathy, where the heart muscle becomes very thick. These people may or may not be aware of it, and then sometimes they may have fatal rhythm disorders like ventricular tachycardia, where they just drop dead or have a cardiac arrest on the court or while they're playing. So it is very important to know the basic CPR or cardiopulmonary resuscitation techniques, the basal life support or the BLS. There are also now a lot of proposal to have a shocking device, the IED, which is available IAD, which is available in on the railway stations, airports, clinics, etc., where if somebody has a sudden cardiac arrest, one can shock them because some of these rhythms are arrhythmias.
And what is a pacemaker?
Pacemaker is something when your heart rhythm slows down, then artificially we can put some wires inside your heart, and that starts to pace your heart from within, and that is called a pacemaker. It's done under local anesthesia, doesn't take more than an hour to do, and the battery lasts for about 10 years, and then after 10 years you can just change the battery. So these are again life-saving procedures that we do.
What should one do if someone suffers a sudden cardiac arrest or a heart attack?
So if somebody suffers a sudden cardiac arrest or suspected cardiac arrest means that some patient has collapsed and is not breathing, the rhythm or the heart beating is not felt, or the pulse is not being felt. That's when you start doing CPR or chest compression. That is, cardiac arrest is different from heart attack. Heart attack basically means that somebody is getting a severe chest pain, the one which I described, is breathing, is talking, is having pulse, or blood pressure may be low, but is having a pulse, and respiration, is mostly conscious. And these patients should be transported immediately to the nearest hospital with an emergency backup. We have two ways to open up these arteries if we find a heart attack. One is to do a primary angioplasty, which is take you to the cath lab, open up the coronary artery after doing an angiography, and put a stent there. That is called a primary angioplasty, which is what is preferred. In places where you don't have a facility of angioplasty and stenting, you could go ahead and do thrombolysis, where we give a drug which dissolves the clot. We call it thrombolysis. So there are many drugs which are available where a single shot of that medicine can be given, and it can help us to dissolve that clot. But that is much less efficient than doing a primary angioplasty. So if your doctor tells you that somebody is getting a heart attack, please don't have suspicions कि ये ठीक बोल रहे हैं, नहीं बोल रहे हैं, or whether it's really needed, because you will have all the ECGs, etc., to your disposal. Nobody is going to tell you without an evidence. So please don't hesitate to go for an angioplasty and stenting in an acute heart attack condition.
What has been the impact of COVID vaccination on our body?
Yeah, so we, as I said, now there are a lot of controversies around COVID. We know that in some of the patients who had COVID, so remember that India is 1.4 billion people, and almost every one of us must have been exposed to COVID. We are also a young nation, so anything which is happening in the COVID times can be attributed to COVID or coronavirus. We did see an increase in the risk of heart attacks, strokes, etc., because even otherwise in non-COVID situations, the influenza viruses, etc., have shown that whenever there is a season of myopericarditis. It can mimic a heart attack. It can lead to less, in very small people. So like 1 in a million person may come up with some sort of a side effect of the vaccine. So this entire paranoia that vaccines cause heart disease or heart attacks is not true. It is an unfound thing. It is something which has been just floated in the media, but there is overwhelming evidence that vaccines saved lives during the COVID era. On the other hand, COVID itself could lead to heart damage. There is no doubt about it. It could cause myocarditis. It could have led to, in fact, during the COVID times, we did not find an increase in heart attack or stroke risk at all during the COVID pandemic. Later on, we are finding much more, maybe because of the lifestyle, the stress, the increase, conglomeration or the accumulation of risk factors in individuals. So I think this kind of a paranoia around COVID is unfound. There is definitely not a very robust scientific evidence that it leads to an increase in heart attacks or strokes directly.
Is the pain in the left hand a sign of heart attack? Pain only in the left hand?
So as I said that there are some classical risk factor, the risk profile for angina or heart attacks, which I had just described. Suppose somebody gets a severe shoulder pain. If I'm lifting my shoulder, there is pain in my shoulder and there is radiating pain in my left arm. Now, obviously, that is very, very unlikely to be related to heart. It is likely a referred pain because of either a shoulder or a neck issue, or maybe some pulling of the muscle in the arm. But if that pain is increasing on walking, suppose there is a 60-year-old gentleman or a woman who is a diabetic for 20 years and says that now when I walk fast, I get this discomfort in the left arm, then that has significance because, it could be angina. So I think it is not just, it depends on the profile of the patient and the character of the pain, where my suspicion would be lit. Any other questions?
Yeah, I think we are nearing time's up. I think we can take one more question. How does one identify hypertension?
How can we identify hypertension? So
Yeah.
one very simple way is to keep checking your blood pressure. Suppose you're 20 years of age, then you can actually casually take your blood pressure, go to a nearby clinic or a doctor and get it checked once in a year. If you are a diabetic or if you're about 40, 50 years of age, you can do that every month, depending on what your profile is. Suppose your blood pressure used to be 140/90 and your doctor said that lose weight, start walking, cut down on salt, and you keep checking the blood pressure, say every month or so. You don't have to check your blood pressure every day or very frequently. There is no recommendation for that. So the easiest way, you do have these home testing devices which are available now. So a lot of people have these machines at home, what we call as a home blood pressure measuring devices, which are reasonably accurate. They're usually recommended for people who are hypertensives or who are at borderline hypertensives, where we encourage them to check the blood pressure at home. There are various types of blood pressure. So it could be at night, which is nocturnal hypertension. Sometimes you come to my clinic, you're anxious, it goes up. So that is called a white coat hypertension. Sometimes some people have more blood pressure at home, which is the masked hypertension. So there are various types, and we can definitely, keep checking casually initially a blood pressure at any clinic or even in your offices, where you can have a nurse or somebody check your blood pressure once in a while. And if you see a consistently high blood pressure above the range of say 140/90, then you should seek medical intervention.
Ladies and gentlemen, we will not be able to take any more questions because the time is up. But what you can do is to write on the email IDs on your screen or WhatsApp on these numbers, and we will get you the answers from the doctor. This program is brought to you from Seva at Home. in collaboration with Ace Insurance Brokers. I suggest you go onto the Ace Insurance Brokers platform, take the assessment today. You will know whether you are at risk or at no risk. It's good to know the condition of your heart and then do something about it in terms of lifestyle modification. Been very enriching talking to you, doctor, and thank you ever so much. Every time we interact with you, there's always more to learn. Thank you so much. On behalf of the audience, on behalf of Seva at Home, and on behalf of Ace Insurance Brokers.
Thank you.